Okay, go ahead and talk,
All right, so
Phil.
we are doing a home fit over the internet with Dr. Downs on his Invisasleep device. This is a DuraSoft device. It has a soft rubber liner and a hard BioAcryl exterior. It's 3 millimeters and it's durable. We've got them preset with the thermoplastic from the lab. So now we've tested that the retainers actually fit on his teeth. So what we did was we had him fit the upper retainers on first. We have a thermometer. And then we put on the mandibular retainers separately to make sure that they fully seated. Now, it's going to be a little grippy at first. So when you first put it on and it's a little snug, that's totally fine because when you wear this over time, it will loosen the fit because you're kind of working at it, like, putting in a new pair of shoes here. And so once you've tested the lower retainers and the upper retainers separately, then we're ready to adjust it for the right fit. So now Dr. Downs is going to get his grin next to the camera so we can see how his occlusion is.
You're going to put me up. Okay.
Yeah, yeah. And then he's going to touch the front teeth together, touch your front teeth together. And we're going to record where his central incisors are connected. He looks about, what would you think, Dr. Downs? I can't quite see. Are you midlined on your central incisors when you touch your teeth? Are you midlined or are you to the right or left on your central
I'm
incisors?
slightly to the left with my
Okay.
lower midline.
Okay, so
Yeah.
we'll probably kind of go with that a little bit, depending on how he's doing.
Mhm.
And you can tell Dr. Downs has a bit of an overbite.
Yeah.
So if we were to open him up to a standard of 4 to 5 millimeters, he's actually skeletally open. Add the overbite on there. If he's got 3 overbite or 4 overbite, that's 8 or 9. So you have to be cognizant of how that's stressing the joint. Most
Yeah.
joints do very well with anything between 3 and 5 to 6 millimeters. You have to be a bigger person or a male to really tolerate 10 or greater and have more severe sleep apnea. So just know that that's kind of your goal there. So I got a little shaving technique there. All right. So now we have the hot water at what temperature?
That 150.
Great. So 150, we're gonna pour that into a cup, and we want to have an implement to keep the retainers from separating. I mean, from over closing when you bite into this thing. You want to control the opening, the vertical. So I typically recommend a disposable white dental mirror because the dental mirror, for example, has a kind of a tapered tip to about 5 millimeters. This is just a scalpel handle there. But then you can kind of control 3, 4, 5 millimeters of
Right.
vertical there. We're going to go ahead and pinch it with a pencil here, okay? And Dr. Downs is going to go ahead and put just the thermoplastic portion of the device. Maybe show them on the camera there, Rick. So you never want to go a little higher on there. There you go. You never want to go above 150 on these types of retainers, depending on the plastics, because you'll distort your plastics. The front of the retainer will actually buckle in like saran wrap, and it won't fit. So you want to be very careful about managing your heat. So what he's doing right now is by having that pencil stuck between the incisors, he only has the thermoplastic in the hot water, not the portion of the incisors that's more susceptible to buckling under hot water. Now we're being extra careful because DuraSoft can tackle anywhere between 140 and 150 to 155. But most other plastics, if they're thinner, like 2 millimeter BioAcryl or Essex material, it will definitely distort in anything above, say, 145. Okay. Now, typically at 150, Rick, it'll take about 2 minutes for the thermoplastic exterior to heat up enough that you can actually adjust it. Okay. The way we're going to tell is we're looking at it occasionally to see if there's a translucence developing around the exterior. If
Yeah.
it's if it's still opaque, it's not adjustable. And here's the point. If between the two retainers you have white thermoplastic between the retainers here, you cannot bite into it. It won't compress. So this has to actually become more translucent so that you can bite into it and it can adjust to your individual bite. Okay. And here's the other problem. You don't want to bite into it and smush down your retainers too much, and you don't want to like be shifted to one side or the other. So when you're setting this with your mirror in the middle of the retainers, you want to gently place the tops on first yourself, and then gently guide the patient with your fingers on their lower retainer and gently let them bite into it to the level of closure that you want it to be in. That's why you want the mirror, or the pencil in this case, to be between the retainers. Take another look at it, see if we've got more translucence there.
Nope.
Okay. Check the heat again, see if it's still in the 150s. If it's not, we need to put more hot water in it.
124.
What is it?
124.
Okay, 124 will never melt. So we need 150. Yeah, we'll be here forever if we are below. Once you go below 140,
What's
you will
wrong with
never,
putting the whole metal thing in the dish here?
because the base of the glass may transmit the heat that's on the base of the metal of the pan. So even though the water's 140 or 150, the base,
Yeah.
if your plastic ends up resting on the base metal of the
Mhm.
glass or the pot, then it's going to melt. So if you're going to put it in the pan, make sure it's not touching the metal surface there.
Yeah.
You have to be very, very careful.
Well, that's why if you put the whole glass pitcher in the metal pan, you would have glass between it and the metal.
Yeah, but the question is how much thermal mass is transmitted from the metal to the glass,
I don't
right?
know. I really
So
don't know.
here's the most perfect tool to have when you're doing this in the office is a water bath. If you have a
Yeah.
dental water bath, it has water, right,
Right.
in an actual metal pan with a metal unit under there, maintaining that heat that you want. You want a perfect 148, I guess.
Right.
And even when we use a water bath, though, we have to put a little plastic um, a base on top of that metal so that when the retainer sits on top of it, it doesn't come in contact with the metal base in the water bath. So again, managing your thermoplastic is the most challenging aspect of this device. This device is very simple. It's a monoblock device that can vertically be changed forever. You can go as far forward as you want or as little forward as you want. You can go as wide open as you want or as closed down as you want. Because it's monoblock, it's not indestructible, but it's very, very strong. Probably one of the stronger devices out there. It has no bulk on it, so unlike an Emma, which has these little buttons on it on the outside, or a Herps that has rods, or a dorsal wing that has big wings in there, this is totally flush. So patients find that it's more comfortable because it's smaller profile. It stabilized the mandible so that a lot of us, when we end up on our back with most of these sleep appliances, we end up opening our mouth and losing some of our jaw protrusion and our efficacy. So what's nice about this device is it stabilizes the mandible so you won't lose that mandibular position when you're on your back. So it's more effective for people who like to supine sleep than some other devices out there. And other devices, you have to end up, relying on elastics to kind of, bind the teeth together there. And if you're wrong on the positioning, like you guessed wrong on the vertical, then this device, you can later on close it down or open it up, because a lot of us don't know a good vertical until the patient starts wearing it, right? So where are we at with the heat now there, Dr. Downs?
139.
Yeah, so it's supremely important to keep track of your heat management. And and again, in this case, because we're in a cooler kitchen, we're going to get up to the 150, we'll just try 155. And in this case, don't turn off your heat on your pan, because what will happen is we'll dump the cold and we'll put some more hot in there, to maintain that heat.
So it's creeping up there. Hold on.
Now, I've done this thousands and thousands of times, so I'm totally ready for the heat management. So I always have a hot water next to my target temperature water, and I start adding it, as it cools down. And I never put too much water into the cup because it'll start to overfill. And we need to probably have anywhere between 2 to 3 minutes of 145 to 150 for your thermoplastic to start to become transparent or adjustable enough to fit on the patient. So you have to understand the characteristics of cooling and heating on the thermoplastic. And once you know that, it's a very simple device. You just have to have practice. And I would say it's going to take you about 10 to 15 patients to get comfortable managing your thermoplastic. But once
Okay,
you
so
do, it's very, very easy.
we're at 137 now.
Yeah. If you're below 140, you're wasting your time.
Okay.
It will never, 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 never heat up below 140.
Mm-hmm.
Um,
It's creeping up there.
and if you have a busy office, you're probably going to be focusing on the 145 to 150 and keeping the incisor part of the retainers out of the hot water while you're waiting for the thermoplastic to heat up. Now, because we did a Durasoft with Dr. Downs, a dual laminate, it can probably take a little bit higher, up to 160. But I'm not going to encourage you guys to do that because then it'll melt and distort and you'll say, Joe, you told me 160. I said, no.
Here.
With Durasoft, you could probably get away with it. But with a BioCryl or a 2 millimeter, you're going to have to remake it. How do I know? I've done it many times over the years. So I got busy. I had too many patients going. I left it in the hot water and it literally looked like it was going to fit, but it did not. It was like I was putting a size 6 shoe on a size 12 foot.
Mhm.
Same style shoe, just not the right size foot.
So, Joe, I have the uh, Pyrex pitcher inside of the metal pan, and it's heating up slowly. Um, what about putting some sort of grid between the bottom of the pan and the Pyrex dish? Would that be something that you think would work for you?
Yeah. If you probably not so much the dish, but
Mhm.
putting a grid on top of whatever surface your retainer is going to
Yeah,
sit on,
right.
because whatever is getting that thermal mass from the base, whether it's glass or metal, is going to
Mhm.
transmit that to the plastic.
Right.
So yeah, if you have like a little bit of a plastic grid, like one of
Yeah.
those mesh strainers or something,
Mhm.
it will displace that heat because it's got those air gaps on it.
Right.
But super important to do that. Then you can kind of just set it there or have a dental assistant kind of monitor that for you.
Okay,
This
we're
is the
just
one
about
challenge to this device. It's incredibly affordable. It's incredibly efficient. It's the fastest one you can make right in the office within a day, within an hour. The only challenge is people have to spend the time to learn thermoplastic management. That's the only thing you have to do. And I
yeah.
was able to delegate this to many dental assistants over the years, and they were very proficient. It took them about 10, 15 patients of being supervised. And once they did that, they became experts, and they helped me fit thousands of these, which is great.
We're at 139.
Yep. So this is a great. Rick and I talked about this before. I said, Rick, leave the heat
Yeah,
on your stove,
yeah, I
and
saw.
and then we can dump the cold water out and then transfer the hot water back into there.
Mhm.
Um, and so now we're trying to heat up the water inside the glass, which is
Yeah.
going to slow things down. So
Well,
the, the
I've
the
dumped it
rule
out,
here,
dumped it
yeah,
back in.
the rule here is to have your separate glass with your constant heated water,
We're
and then
at one. We're at 140 now.
yeah, we want to go higher than that because once it goes in the glass, it's going to start cooling off.
Yeah.
So once you know it's inevitably going to cool off, you dump the cold water and you put the hot water. You keep transferring it over there, so you always maintain a heat level.
Yeah.
Otherwise, you're going to be spending a lot of time waiting for the water to heat up.
Yeah.
We did this on purpose just to show you guys what not to do.
Okay, so we're at 143.
Yeah, shoot for 150 just because we're transferring it over. Because the minute it goes over to your glass,
Yeah.
Dr. Downs is in Iowa. What's the current ambient temperature in the kitchen, Dr. Downs?
Well, we keep our house at about 72.
Oh,
So,
really?
yeah, in the daytime. At night, we turn it down um, for sleeping.
Well, that's because you're a dental sleep practitioner. You understand you need to have that cooler room to get better deep sleep. Sorry.
Right.
And patients,
That's
dentists will ask us, well, sorry, I got some in my, why do you want to have the room cool? Well, it turns out that a cooler room means a cooler brain. And a
mhm.
cooler brain means a lower metabolism, which means it's more likely to get into those waveforms that are consistent with deeper sleep. Remember, sleep is an active process. You need to have many parts of a puzzle connected before the brain can click into, or flip, as they call it, into sleep mode. It's not something that just happens naturally.
We're at 146.
Almost there. We want to go to 150,
All right.
maybe even 155, just to be on the safe side here.
All right.
Remember, we're in your case, we're using a 3 millimeter Durasoft, so it's more resistant to distorting with hot water.
Sure. Well, I'm being
But it,
careful with it.
yeah, and you're being careful with the incisors.
Yes.
Um, but
Keeping the
anyone,
incisors out of the bath.
that's right, anyone who does a thinner BioCryl or an Essex, or if you just finished your Invisalign or your Candid Pro or one of your other aligner cases, and you want to get them into an Invisasleep as a sleep apnea treatment and a treatment to keep the teeth aligned, you're going to want to go to a thicker device. You don't want to go with the classic 0.75 millimeter. You're going to want to go 1.5, 2 millimeters, because the jaw will flex side to side and it'll test the plastics and it'll stretch it out very, very quickly. So a good fit in 3 months will be super sloppy. It'll fall right off like a stretched out pair of shoes. So you want to
We're,
take that into
we're
account.
starting
And
to see some clearness to a little bit of clearness to the thermocryl. So
okay, so,
not quite completely though. Okay.
yeah. So you want it to be pretty clear. Now
Yeah.
don't forget, once it's fully transparent, you're going to have to be very vigilant about managing your thermoplastic, because if you bite down too fast, it's totally flexible. It'll smush, and it
Yeah.
has a tendency to slide side to side and mush everywhere. So
Yeah.
you've got to be the dance partner. I always tell people there's a leader to the dance, right? So someone's going to follow the other person dancing.
Right.
So when you go to put this on a patient's mouth, you're going to tell them beforehand, I'm going to place this on your teeth. And once the upper retainers are on, I'm going to have my fingers here, and I'm going to slowly have you gently biting into the lower retainer. Remember, my fingers are here. You don't want to bite my fingers off. And then that will let them know not to bite too hard.
Right.
And then once you get them fully in, you'll say stop and stay right there, and say stop, stay. Because if you don't say stop, stay, they'll stop and then they'll open their mouth and they'll stretch everything apart, right?
Right.
You have to be kind of clairvoyant. You have to know what they're going to be doing, right?
Right.
So I want you to have it pretty much fully transparent there, Dr.
Yeah. It's
Downs.
about there. We're at um
What's our heat at?
yeah. Hold on a second here. 153, 154.
Okay, so you'll see when it gets in the 150s, it heats up very quickly within about a minute, right?
Yeah. Right.
145, you're looking at about 3 minutes. And again, like I said, with the Durasoft, you're less likely to cause distortion, but with a thin BioCryl, you're going to be playing with fire if you go above 150, right? So
So I can see that the trays are moving slightly.
yeah, because they're getting the thermoplastics now stretchy, so it
Right.
doesn't hold it together over the pencil. So now you can pull the pencil out and just hold the tips of the incisors there yourself with your fingers, right?
Yeah. We're at 155.
Okay. And how's the plastic looking?
Pretty clear.
Make sure you're only holding the maxillary retainer, not both of them together, because you'll smush them together and close it down if you are holding both of them.
Yeah. Got it.
So if you're holding your thermoplastic, your device in the water like this,
Yeah, I understand.
as the thermoplastic starts to get flexible, you're going to collapse it, which is not what you want. You want to
Yeah.
keep that vertical that we kept in there like that, so
I
that
think we're
this
ready to take it
stays.
out. I'm gonna take it
Let's take
out
a peek
now.
at it. Bring
Okay.
it closer to the camera so we can see the thermoplastic. Go to the side there, a little closer, a little closer, a little closer, over to your left there. There. So you can see there's a little white nucleus to it. That's unmelted thermocryl.
Okay.
That's okay. That's okay.
We'll put it in.
Yep. Go ahead and don't put your thumbs on the bottom mandible. You want to place it on the maxillary when you're putting the maxillary in. So you don't want to move around that mandible. You want to place the maxillary. And why don't you turn your camera up there a little, Rick? Make sure you're fully seated on your maxillary before you put the pencil in, Rick.
I will. We're losing a little bit of the positioning here. It's okay.
Yeah, just open it up. There you go. Okay, and then just press your maxillary on by putting your thumbs on your 8 and 9, the incisal tip of 8 and 9. If you're going on to your mandibular retainer, it's going to distort. Go ahead and get it started, and then just put your pencil in there. You don't have to bite into it all the way. Get your pencil in there so it's got a separation, and now find your lower retainer and gently bite into it. Pull the retainer back a little bit if it's too far forward, and leave that pencil there so it seats itself. And if it's hard to get into, it's because you're too far forward. You can push the lower retainer back a little bit. And it should be fully seated in by now. Are you in it already?
Nope.
Let's take a look at the thermoplastic. It might be too cooled down. Let's take a look
But
at
it's
it.
okay. I'm gonna try it in.
Okay. But make sure that the pencil's between there when you bite into the two of them. Otherwise, it's going to compress too much. You should be able to just bite into it like a sandwich.
Mhm.
Because we proved that the incisors fit earlier. It's probably too set up in the back. Let me see the thermoplastic in the back real fast near the camera there, Rick. Let me see it in the back there.
Just a minute.
I want to demonstrate it to the viewers that this is what it looks like if it's not compressible.
Yeah, it is compressing a little bit.
So what happens with the thermoplastic is if it's not fully translucent in the back, and are you sure you got the maxillary on there? Good. Okay, that's the one thing too. You want to make sure that the patient's you got your maxillary on and you're not trying to bite into the mandible on the wrong side. That can happen. Okay, slowly bite into it. It should go right in. Because we demonstrated the grip earlier. So if it's in a good jaw position, it should go right in there. Is the device too far? Come a little closer. Yep, you're all the way in there. You're all the way in there. Now keep your central incisors lined up. So if you're going too far to your left, move your jaw to your right a little bit. If you're too far to the left, just move your jaw to the right. And leave that mirror in there, depending on how vertical you want it. And then what I do is I have the patients rest on the obturator so their jaw doesn't get sore, because what they'll tend to do is they'll automatically bite into it, and they'll get like fatigue here. So you want them to rest, but you don't want them to open. Okay, so you have to be very specific in telling patients what they're doing. Okay, now that we're in, I want you to rest your jaw, but don't open. Just rest on this mirror or pencil in this case. Now, say we set this and it's too vertically open for the patient. They want it more closed down. Well, then, like with the mirror, the disposable mirror has like a 1 millimeter, actually a 2 millimeter, 3 millimeter, 4 millimeter, 5 millimeter graduation there. So I would actually slide the disposable mirror to the 2 and have them reheat it and bite down to the 2 or to the 3 or to the 4 or to the 5. So that's why I encourage everyone to grab a box of the disposable white dental mirrors, because the handle is graduated from 2 to 5 millimeters. Okay. And then take your cheek to the side there, Dr. Downs, and then let's look at the thermoplastic, see if it looks cooled down. It's still pretty translucent, so we want to be very careful not to let the person open or move their jaw side to side. So in the dental office or in the chiropractic office that's been trained in this, you can grab some of the endo ice that you use for testing teeth, and you can just spray a little bit on the sides to speed this up. Once you know you're in the right spot, you can spray just a little bit of endo ice right on the thermoplastic right here and right here, and that'll cool it up really, really fast. But right now, we just want Dr. Downs to rest on the retainer, and then watch when his lips come together. He's got lip confidence there, so just let your lips rest down. So he's got pretty good lip confidence there. There you go. Thanks for being our Vanna White for the demonstration there, Dr. Down. So now you guys see it's all about thermoplastic management. You have to understand the Thermocryl. Okay, you have to understand how long does it take to heat up, how long does it take to cool down, to manage the position. Once I've sent you a device set in this position, if you let that stuff heat up and not control it, once you fit it, the jaw will go this way, that way, it'll squish this way, it'll go everywhere. And let's take another peek at the thermoplastic. What do you think? Pretty opaque or no? Still pretty translucent.
Looking pretty good.
Do me a favor. Why don't you grab some cold water and swish it around in your mouth. You can take the pencil out. Don't bite anymore. Just relax the teeth. So once it becomes semi-opaque, you can feel pretty comfortable that it's not going to fully collapse. But another tool that I use is it goes from transparent. There you go. It goes from transparent to opaque, right? So when it's kind of semi-transparent and opaque, sometimes I'll pull the mirror out and I'll have them gently, lightly bite down for a second just to make sure we fully seat it in case we didn't get 100% seating of the teeth there. Okay, and then go ahead and spit that out, and then let's see how cool, how white that stuff is. Is it pretty white now?
Good there, yeah.
Okay, so we want to make sure it's fully white before we try to take it out, because if it's even slightly transparent, it's going to distort the position. So we have to make it sure it's fully white. Maybe one more swish of cold water to cool her down there. And for me, the way I manage this is I just kind of talk to him about what to expect with dental appliance therapy, right? So I'm waiting for this thing to set, and I'm talking to him about it. I'm letting him know that, initially the first week, I don't expect you to wear it the whole night because it's new. So if you can only wear it for a few hours a night and your teeth a little sore or it's making you drool, totally fine. I give them permission to take it out and go to sleep without it in. Each night, as they get more and more used to it or desensitized, by the end of the week, pretty much everyone's wearing it. And they're feeling more rested and they're feeling they're getting some benefit out of it. They've loosened up a little bit because, like a new pair of shoes, once you wear it in a little bit, they're going to be more comfortable. And then I usually see them back in 2 weeks just to see how they're responding to the initial position. Because remember, the position that you're starting with is the initial starting position, kind of like training wheels. That may not, in fact, be the treatment position. We may have to move it forward. So depending on what the patient says, you can use SnoreLab app. You can use, now this is a good example. What's your incisal position right now, Rick?
Well, it looks like I'm slightly to the right.
That's right. That's right. So now when he was in the device, he slid to the side because you have to keep track of how the patient's jaw is doing. So this is a great example. Dr. Downs, pop the lower mandible off. I want you to put your thumbs underneath the bottom. Just put your thumbs underneath the bottom. Press up. Okay. Now slowly bite back into it. Okay. Now when you're biting into it, do you feel like you're being slid to the side, or you feel like you're going right into it?
That feels good.
Okay, so in his position, that's actually probably your right skeletal relationship. So try that one more time. Pop the mandible off, and then have them gently, slowly bite into it, and watch that they're not deviating one side or the left. If they look like they're going right into it, that's their correct arc of closure. So that's correct for you.
Yeah, it's good.
That looks, yeah. So now we're going to go ahead and have them pop the bottom ones off. And then there's a technique, Dr. Downs, on the uppers there. You can grab the back molar on the opposite side like this.
Hmm?
And pull one side off first, or
Yeah.
you can wiggle it down on each side there.
Hey, looks
So
pretty good.
so now let's take a peek at it, get a little closer there. We ended up with a bit more vertical collapse because you must have taken the pencil out before we were done. So we're only about maybe 3 millimeters open.
Yeah.
We're about 2 millimeters, maybe 1 millimeter negative on the advancement. You can see there's a little compression on the thermoplastic here. So
Didn't
if you
quite,
run your,
we're not quite as far forward as I would think I was, at, but it's not bad.
yeah, it's a good starting point for you. It's a good starting point for you.
Mhm.
So guess what we do? If you're in the wrong spot, you put it back in the hot water, get it translucent, move everything to where you want it to be,
Yeah.
and then put the mirror in a little bit bigger.
Right.
Bigger is better right now. And then watch your jaw position. You want to keep an eye on where that jaw's at. Okay. So
Yeah.
if it's sliding backward while it's cooling down, you're going to tell the patient, okay, move your lower jaw forward. Now, don't forget, people
Actually,
think,
if I look at this and I look at the midlines, my lower jaw is slightly left of the upper. So that's probably where I want to be.
okay,
The only thing that I'd change possibly is more protrusion, but I'm not so sure I want to try more protrusion right now. I think I want to leave it at this particular, it's pretty much edge to edge at this point.
yeah,
Okay.
it's probably just 1 millimeter shy of edge, which is a fine starting place for you
Right.
because you have a bit
Right.
of an overbite.
Right.
Now, there's one more step for patient compliance. Okay. You
Okay.
need to have a hand torch.
Okay. I don't have one.
And that hand torch, you're going to gently kind of paint the thermoplastic. And with
Mm.
wet fingers, you're going to lightly smooth off that thermoplastic so it's
Yeah.
nice and smooth. Right
Okay.
now, if you show them the thermoplastic, you'll see there's areas where the thermoplastic's smushed out in the back,
Yeah.
around the tongue area. If you feel your finger there, there's a little bit of thermoplastic that's smushed
Yeah.
into the tongue area.
It's a little bulged in the back right here,
Yep, yep,
and a slight bit on the lower mandible left,
yep,
but
yep. And that's
that
not
could be easily
bad.
smooth. And
It's
yeah,
not
a
bad.
little bulge here and here,
It's not
little
bad.
bulge
And
here and here.
and you
Yeah.
did really well for your first time because most people it goes all over the place and smushes everywhere. So you did pretty good job on your first time. The other thing you could do if you don't have a dental torch is you could take the hot water, right?
Yeah.
And then dip it back into the hot water for about, say, 30 seconds. And you'll see the surface is more translucent and the inside still opaque. You can gently kind of smooth it off with your finger like that.
Yeah. Okay.
Okay.
Yeah.
But when you get to be more expert and you're a little bit more impatient, what you'll do is you'll take the torch and you'll just gently kind of wand the
Right.
torch against the
Right.
thermoplastic, just like this. One,
Right.
two.
Yeah.
Okay.
Okay.
But don't torch your retainer because it will melt the retainer. You have to be very diligent about using the torch judiciously and patiently on the thermoplastic.
Now, one
Okay.
of the reasons you wanted to leave a little space is for the eye breath, right?
That's right. That's right. So the eye breath and the monoblock are going to work out great together.
Yeah.
So the eye breath is compressible. So go and grab the end of the eye breath and just kind of push it in there, Dr. Dan. Just kind of grab the tip there. Just shove it in there.
Try. So eye breath
It,
can go in there, but it's a little too tight for it, but
yeah,
it will work.
you just have to slide it in there, and it might be kind of nice because it'll keep the eye breath where it needs to be there too. But
Yeah.
the eye breath is stretchy enough. If the eye breath is finding it hard to get into, then that's a pretty closed down device. That's about as
Yeah.
closed down as the device can get.
Yeah. Let me just get it in there for you, and then I'll show it to you.
Now, one of the problems with a dental appliance is if you're not being accountable for good nasal breathing, or if you have naturally nasal restriction because of a number of
Okay. Eye
reasons,
breath is in.
good, then you can get dry mouth. And to avoid dry mouth and to encourage nasal breathing, we put the eye breath over the Invisasleep here. So go ahead and pop it in there, Dr. Downs.
All right. Just a minute. Make sure it's centered here. All right.
And make sure it's fully centered. Make sure you have the maxillary you're biting into, not the mandible. And always double check that you've got the device in the right position. You want to see the big teeth on top, the small teeth on the bottom, because people always flip it around when they try to put it in. And if you try to bite in the wrong retainer, it's not going to work. Okay. Just push your lips out there, Rick, so it goes over it, and then it'll go over just fine. Okay, and now suck on a little bit because you want to suck on the device so you get the little seal around the lips there, and the tongue goes into the roof of the mouth. How does that feel? Does it feel like you're keeping your lips better closed?
Mm-hmm.
Yeah, and that's what's really great about the monoblock is you can basically encourage better tongue position, and by having better tongue position, you don't have to be as aggressive on jaw protrusion. The combination of these two can be very, very effective. Now, again, don't forget, you can have a little bit of jaw soreness in the morning after wearing this for the full night because it is new. You tend to bite on it. It's going to take some time where your body can actually reduce the biting habit. So tell the patient you don't have to wear it the whole night. You can use it for as long as it's comfortable. And in the morning, there's some exercises. So go ahead and go to Sleep Balance Academy. Look at our morning exercises video to see how we recover the jaw position. Because when your jaw's forward, the muscles get tight and they need to be stretched backward. Okay, they need to come back. And in the morning, you kind of have to help them do that a little bit.
Okay.
Good,
So there you
good
go.
job, Dr. Downs. That was your first Invisasleep fitting, and I think you got an A minus because the thermoplastic took a little long to heat up.
Well, I just need to get a water bath would be better. So this is really good that you can put this eye breath along inside the Invisasleep. That is a really good thing to have.
Yeah,
Okay,
and it's a
very
great
nice.
transition from aligner therapy with epigenetic
Yeah,
arch development into
right.
long-term jaw stabilization.
Yeah,
You need good muscle tone of the tongue. You need good nasal patency for a mouthfunctional appropriateness. You need to have a jaw obturator or something that blocks off mouth breathing to encourage nasal breathing and tongue posture. This is a fantastic way to give you the most streamlined, durable, affordable mandibular advancement therapy out
right.
there. So
So this is great. I'm going to go ahead and hit stop on this recording. Thank you,
sounds
Joe.
good.
It was a great educational program.